Hi, my name is Daniela Maya. So I had the wonderful opportunity to interview Justin DeLeon, who is a clinical informatics specialist here in Moreno Valley at a local hospital. Justin DeLeon his medical experience began in 2017, where he got hired as a new grad in the DOU and ICU unit. He worked there for 3 years before deciding to go back to get his master's degree. And in the year 2022, he advanced his career and became charge nurse of that DOU and ICU unit. In the years 2022 to 2024, Justin DeLeon worked as a charge nurse, but also intermittently filled in for the ADA at his hospital and also the informatics specialist. So he was charge nurse and also filled in for those two positions. Late 2024 is when he got hired at his position that he has now as clinical informatics specialist. So the value of the informatics nurse at our hospital is critical. It's a critical role in nursing care and the care that we provide daily. It also takes place and helps with our EMR. The main purpose is to support nurses and to improve patient care. So a typical day for Justin is he starts at about 8. He said when he goes to work, he reviews his daily schedule, preps for any meetings. A lot of his time is touching base with IT to discuss any issues or potential issues. And then he's working on a lot of projects at our hospital, so he makes sure that he follows up on deadlines and requests any data that he may need. He also rounds the units every day that he works. Justin said that this position requires him to be very flexible because sometimes he has to stop what he's doing and kind of rearrange his day to be there. Like we had state come to our hospital a few weeks ago. So he just said that his position requires him to be very flexible. Technologies that we currently use to help improve patient care. The first one that Justin DeLeon stated was the telecritical care virtual system that was used in the ICU. He states that this system connects nurses with a team of intensivists, mainly night shift. He said night shift had relied on on-call providers for emergencies. Now using this system, the nurses in the ICU can immediately interact with the critical care nurse or provider via camera to discuss patient needs. So somebody is always available to speak with the nurse if they have any questions or the provider. Another important technology that we use that has improved patient care is the Region Team Care Report. This is a portal that Justin uses. He said it helps summarize the quality of care within a specific region. So he can look up any region, but he can get highlight performatics, metrics, patient satisfaction, and identifies areas for improvement. Safeguards that are in place at our hospital are BPA, which are best practice alerts. These alerts provide reminders on critical information during the actual point of care. For example, when you're working with a patient and in their chart, these BPA reminders will come up stating if patient is due for the flu shot or if they're due for any critical labs. It gives you that reminder to help improve patient care and to kind of help be there just so we don't forget anything. The hospital is currently on the journey to become magnet. So Justin is very occupied with assisting our hospital. He advocates for the magnet model, promotes magnet culture, oversees the whole applying process, and ensures that we are complying with all laws and regulations. This interview will impact my practice as a master's prepared nurse. I never knew how much goes into being a informatics nurse. These nurses are very experienced and well-rounded. They understand many aspects of the role of a nurse and beyond that, because they are helping the whole healthcare system, bridging medical care and IT. So the role of this position is very important.